Mrs. Berry?
Yes.
Hi, I'm Missy. I'm going to be your student physical therapist today. You can go ahead and come on back with me here. And you can take a seat right here on this table. Have you ever been to physical therapy before?
No, this is my first time.
Okay, so I'm going to explain to you what we're going to be doing today since it is your first time, just to make you more familiar with the process.
Okay.
So what I'm going to do is just start by asking you a few questions, get to know you a little better, and see what brings you in today.
Okay.
And throughout this process, I am going to be taking down a few notes just to make sure I have everything correct. Is that going to be okay with you?
Yeah, that's fine.
Okay. So before we get started, I just want to confirm your age. Can you tell me how old you are?
58.
Okay. All right. So what do you do for a living?
I teach English at a community college.
Mm-hmm.
I'm a professor there.
Okay. And how long do you work?
I work about 6 hours a day. Only work about twice a week or so.
Okay. So do you do anything else on those days that you aren't working?
Yeah, so whenever I'm not at school
Mm-hmm.
or on campus, I have to do a lot of prepping for my class at home. And I also do some instructing for some spin classes.
Oh,
also.
okay. So you sound pretty busy.
Yeah, very busy.
How often do you instruct for those spin classes?
For the spin classes, I do it about like 3 days a week.
Okay.
Mm-hmm.
And can you describe to me what's a typical day at work like when you are up at the school?
So at school, 6 hours a day. I'm doing a lot of, sitting down whenever I have to read emails and do a lot of things for my class. And then do a lot of standing whenever I do have to, give lectures out and things like that, giving back papers, things like that.
And what about whenever you're working at home?
At home, it's a little different, so I'm mostly just sitting down a lot, prepping for my class, and I do that about like 6 hours a day, and I do that only about like twice a week as well.
And then what about for your exercise class? What does that entail?
As a spin teacher, it's just a lot of very intense biking. A lot of interacting with others. Sometimes I do have to yell at them and things, just as a little motivation for them. So.
And are you still able to do all of these things currently?
Yes, I am.
Okay, well that's good. So I know that you told me you do like to instruct for spin.
Mm-hmm.
Do you do anything else for exercise?
Usually my exercises while I'm instructing. I feel like not two birds with one stone.
Yeah.
Being able to teach while get my own workout in.
Yeah, that's definitely a good workout. I've been to some spin classes and they're pretty tough.
Yeah, very tough, very tough.
So do you have any other hobbies that you like to do when you aren't working?
Yeah, so whenever my schedule isn't so busy, things like that, I do actually just like to go outside and just look at the stars.
Okay. And is that something that requires a lot of time, or is this more of a casual thing that you do on your own?
It's really just like a casual thing. It's something I just started getting into, and I really enjoy just being able to get away from all these students and the very fast-paced life. Always constantly having to do something and just being able to relax and enjoy nature.
Yeah, that sounds nice for sure.
Mm-hmm.
Okay, so can you tell me what brings you in today?
Yeah, so I've been having this pain in the back of my neck, about right over here.
Do you mind if I go over there and place my hands just to confirm where the area is?
Yeah, sure.
Okay. So you're saying right back here?
Yeah.
And is that the only place that you're having pain?
No, so I do also been getting pain on my right side, right above my eye as well. That's been bothering me as well.
Okay, so let's go back to that first pain that you were telling me about, the one that's back here.
Okay.
How would you say that pain feels? Can you just describe it to me?
Yeah, it's kind of like a dull pain. It's pretty constant. It's just something that I feel like is typically always there.
Mm-hmm. Do you ever have any numbness or tingling?
No.
Okay. And would you say that pain is close to the surface, or do you feel like it's deep?
I feel like it's on the surface.
Okay. And so we have a scale that we like to use when we're describing our pain.
Mm-hmm.
So 1 is going to be no pain at all, and 10 is going to be the worst pain that you've ever had.
Okay.
So as of right now, what would you say that pain is for the back of the neck?
I'd say right now it's probably, I guess, about a 3.
Okay. And what about when it's at its worst?
At its worst, I'd probably say about a 7.
Okay. And then what about at its best?
At its best, it's almost like it's not there, so probably like a 1.
Okay. And now let's go to that other pain that you were telling me about, the one that's behind you said your right eye, correct?
Yeah, it's like right above my
Or above
eyebrow.
it? Mm-hmm. Okay. How would you describe that pain?
It's kind of like a sharp pain. Like this headache, it's just a pretty sharp pain.
Okay. And would you say that it's a deep pain, or is it more close to the surface?
I feel like that one's it's kind of both. With that one, it comes on and then sometimes will go away, but usually it's just like this whole area. Can't really describe how deep it is.
Gotcha. Do you ever have any numbness or tingling in this area?
No.
Okay, good. And what would you say this pain is at right now?
Right now, probably say about a 1.
Okay, and what about when it gets to its worst?
At its worst, it's like about a 5 out of 10.
And then what about when it's at its best?
At its best, as it's not there, so a 0.
Okay, well that's good. At least there's some time where that other pain is not there.
Yeah.
So now I want to talk about, actually before we move on, I just want to confirm, do you have any pain anywhere else, like your shoulders?
No, nothing in my shoulders.
In your back?
No.
In either of your arms?
No pain over there.
Okay. Do you feel like you have any other pains that I feel like I need to know about before we move on?
No, just the ones that I described.
Okay. Mm-hmm. All right. So, do you ever have one pain without having the other?
Typically, whenever, because this pain is the one that's always like there.
Mm-hmm.
I feel like whenever it gets worse, my headache pain will get worse. So they're kind of like, I guess, together in a sense.
All right. And talking about that neck pain, what would you say bothers that the most?
So, like I said, how I like to teach spin classes, always having to look up whenever I am teaching. That's something I feel like is causing that pain that I have.
Okay, and how would you rate that pain whenever you get that during your spin class?
Say about like a 4 out of 10.
Okay, and how long does it take for it to go away?
Usually, if I just maintain that position, it will get worse. So, probably like 5 minutes or so.
Okay, and then what about your headache? What makes that worse?
So kind of the same thing with if I'm maintaining like that position where I'm always looking up, that is something that I feel like makes that headache worse.
Okay, and could you maybe put a time frame about how long you think that takes for the headache to come on?
Usually probably about the same thing, when about 5 minutes or so.
Okay.
Whenever I'm holding that position, that really makes it a little worse.
Okay. So when you do get these pains, what are some things that you do that makes it feel better? Let's talk about that neck pain first.
So usually like looking down. Something I did forget to mention. Something that does make it worse is looking up, because whenever I'm looking at the stars and things like that,
Okay.
That really makes it worse. So that's why when I said when I'm looking down, that eases my pain.
Okay. Is there anything else that eases your back or neck pain?
Yeah, so usually like if I like to lay on my side. I feel like that's something that really helps me, and I do like to do some like some massage on my neck. I like to put some pressure on it. When I do that, I feel like that makes my pain feel a lot better.
Okay. And how long would you say it takes for your pain to come down when you are doing those things?
I'd probably say about like 30 minutes or so.
Okay. And is there anything that you do differently for your headache pain?
No, so just the exact same thing. So looking down, laying on my side, and doing those massages. That when it helps my neck pain, I just feel like it's doing the exact same with my headache.
Okay. Well, I'm glad you found some things to help with your pain. It sounds like you have a lot of different techniques to help with, which is nice. So now I want to get a picture of what your pain is like throughout the day. So first we'll start out with that neck pain that you do have. What does it feel like in the morning?
In the morning, I feel like it's probably when it's at its best. It feels a lot better than it is, usually later on in the day and things like that.
Okay, so you would say in the morning it's good, and then throughout the day it gets worse?
Yeah, definitely. Especially when I'm working, when I have to do like my exercise classes, those things I just feel like puts a lot of stress on me, so it's making my pain worse.
That's understandable because you're so busy, always doing a lot. And what about at night? How does it feel?
At night, I feel like I have that headache. That I mentioned earlier. That one I feel like is the main thing that's bothering me at night.
Okay. And so all that you're mainly talking about your neck pain. Is there anything different that I should know about as far as your headache in the morning, throughout the day, and at night? I know that you mentioned it comes on at night.
Mm-hmm.
So do you have it in the morning and throughout the day?
No, it's just usually at night is whenever that headache is really bothering me. Throughout the day and things like that, it's not really causing me too much trouble or anything like that.
Okay. All right. So I did look over that medical form that you filled out for me before I brought you back here, and I just have a few questions that I want to ask you about it. So do you have a history of cancer, or anybody in your family have a history of cancer?
No.
And I am going to ask you a few questions that may seem out of the ordinary, but this is just to help me confirm that nothing else is going on, okay?
Okay.
So do you have you noticed any changes in your bowel or bladder movements?
No.
Okay. And do you feel like you've had any dizziness?
Dizziness? No.
Okay. And what about any nausea?
No.
Any stomach problems?
No.
Okay. And what about any clumsiness or just feeling like you don't have your balance?
No.
Any difficulty swallowing?
No.
Any changes in how you're able to taste food?
No.
Okay. All right. And have you had any imaging done of your neck or head?
I got an X-ray taken a couple days ago.
Okay. And do you have the results back from that?
Yeah, he told me that it was negative, so nothing's wrong.
Okay, so your doctor was the one that told you that?
Yeah.
Okay. All right. Well, that's good. And are you currently taking any medication?
Yeah, I'm taking some ibuprofen.
How much are you taking?
Take about like 600 milligrams or so.
Okay. And how often are you taking that?
With that, I usually just take it whenever I need it.
Okay. And you feel like that's really been helping you?
Yeah. Mm-hmm.
Okay. And are you taking any other medications or any vitamins or anything like that?
No, that's just it.
Okay. And throughout this process, we are going to develop some exercises and stretches for you to do on your own when you aren't here.
Mm-hmm.
And I want to make sure that I'm able to present that to you in the best way possible to help with your learning style.
Mm-hmm.
Is there a specific way that you'd like me to present these to you?
Yeah, I like to, I guess you show me, and then that way I can do it myself.
Okay.
I feel like me physically doing that really helps me retain things.
Okay, well, we'll make sure to do that when we get to that point, okay? So let's go ahead and talk about how this pain and your headache started coming along. So go ahead and just tell me about that.
Okay, so my neck pain has been hurting on and off for a while now, but this headache that I've been talking about, that one is pretty new. Yeah.
Okay, so when you say for a while, can you put maybe a guess of a time frame for that, for your neck pain?
Probably about like a month or so.
Okay.
Especially because I started looking at stars and stargazing. I started that 4 weeks ago, and I feel like ever since then, that pain that's in the back of my neck, that's been getting worse, and then because of that, I've been getting like that headache that I've been talking about as well.
Okay. And so you said the headache is pretty new. How can you, I guess, put a time frame on that? Like how new?
Probably about around the same. So 4 weeks up, maybe about 3 weeks or so.
Okay. And would you feel like this has been staying the same, getting worse, or improving over the past 4 weeks?
I feel like it's been, over time, it's just been getting worse.
Okay. And is there any other neck movement? I know that you mentioned looking up.
Mm-hmm.
You think maybe it's connected to this, but are there any other neck movements that you think could have caused this?
Can't really think of anything else other than looking up is the main problem for me.
Okay. And do you have a previous history of any neck pain?
No.
And what about any headaches?
No, I haven't.
Okay. So, what would you like to accomplish here at physical therapy?
One for sure, I do want to just be able to get the movement back in my neck the way it used to be, and just get rid of this headache that's just been bothering me.
That's definitely understandable. I know that can be frustrating. Is there anything else that you'd like to accomplish?
Yeah, so just being able to, look at the stars without any issues, and working how it's been making it harder for me to work. I just want to be able to get through like an hour of spin class. When I'm instructing the people that are there for my class, and have that without any pain.
Well, I'm glad that you came in here today because I think that we can help you out with that. I know that sometimes it's hard to actually come in here and take care of yourself, especially with somebody with such a busy schedule like yourself. So I think it's really great that you're in here today.
Thank you.
So that completes the first portion of this exam, where I'll be asking you some questions. Next, we're going to move on to more of a physical assessment.
Okay.
So before I do that, I do want to see, what does your neck pain feel like right now on that scale of 1 to 10?
Right now it's probably like about a 2, I'd say.
Okay, and then what about your headache?
My headache, I'd probably say about a 1.
Okay. All right. So the first portion that I'm going to need to do is just observe your posture.
Okay.
So that's going to require you to remove your shoes and socks, and then I am also going to need you to remove your shirt.
Okay.
Is that okay with you?
Yeah.
Okay, so you can go ahead and do that and stand up. And you can face that wall over there. And just stand normal, you can just relax. Okay, now go ahead and turn to your right. All right, and go ahead and face me. Okay. Okay, so the next portion, you can still keep your shirt removed and your shoes and socks. And what I want you to do is just walk normally to that wall and back.
Okay.
All right, so you go ahead and do that. Good. Okay, so you can go ahead and put your shirt back on. And then you can take a seat there. And next what I'm going to do is just look at some motion and some other places of your body that are near the area just to make sure that those aren't involved in causing some of the problems that you're having, okay?
Okay.
So first we're going to look at your left shoulder.
Okay.
So I want you to bring your arm up like this and let me know if you have any pain or anything.
No pain.
Okay. So go ahead and do that same thing, bring it up, and I'm going to apply a little bit of pressure and you let me know if anything changes, okay?
Okay.
So same thing. All right, keep it there. How'd that feel?
That's fine.
Okay, so next motion I want you to do with that same arm, I want you to place it behind your head like this. Any pain or anything?
No.
Okay, so go ahead and keep it there, and I am going to apply some pressure.
Okay.
How'd that feel?
That's fine.
Okay, and one last thing. Same hand, I want you to bring it back behind your arm like this, or behind your back like this. And now I'm going to relax it a little bit, and just let me go ahead and grab it. And I'm going to pull out. Any pain or anything? Okay. Yeah. And then I want you to go ahead and reach across your body like this. Good. Any pain or anything?
Nope.
Okay, so now I'm going to apply some pressure. You let me know if anything changes.
Same.
Okay. All right, so we're going to do those same motions on this side. So bring that arm up by your ear like that. Keep it there. Any pain? Okay. Behind the neck. Apply some pressure, just like you did on the other side. How'd that feel?
That's fine.
Okay, now behind the back. And I'm going to pull it down and just relax. How'd that feel?
That's fine.
And then go ahead and reach across the body. How'd that feel?
That's good.
Okay, so now I'm going to look at your back and make sure that's not involved as well.
Okay.
So I want you to place your hands behind your head like this, and I want you to lean forward. Any pain or anything with that?
Nope.
Okay, so go ahead and stay in this position, or you can come back up. All right, so I'm going to explain to you what I'm going to do. So we'll still stay in that position, hands behind the head. And I do want you to lean over. Don't do it yet. And whenever you're in that position, I am going to apply some pressure on your shoulders, and you let me know if anything changes, okay?
Okay.
So go ahead and bend forward. Okay, and then stay in this position. I'm going to press one more direction. How'd those feel? You go ahead and come up.
That's fine.
Okay. All right, so now I want you to put your hands behind your head again, and I want you to lean back. Any pain or anything, you can come back up. Okay, so now we're going to do the same thing, and I am going to apply a little bit of pressure, okay? So go ahead and lean back. All right. See, still keep your hands up there.
Okay.
And I want you to side bend to the right.
To the right. Okay.
All right. And then to the left. Any pain or anything?
No.
Okay, so go ahead and I'm going to place my arms around you, and I want you to lean towards me. And I'm going to apply some pressure. Okay. That feel okay?
Yeah.
All right, and one more. I'm going to do the same thing on this side.
Okay.
So reach around you. Okay, so lean towards me. All right. How'd that feel?
That was fine.
Okay. Let me write a few things down.
Okay.
Okay. So now what I want you to do is show me something that recreates the pain that you're having. Just either emotion or anything that you want.
Okay. So earlier how I said just like looking up is an issue, I guess so. Whenever I look at the stars, I like to go like that, and that's probably the movement that causes my pain.
Okay. All right. Let me write that down. Okay, so next what we're going to do is look at the motion that you do have in your neck, because I know that you said that that's been bothering you a lot.
Right.
So the first thing that I want you to do is bring your chin towards your chest,
Okay.
and I want you to keep it there because I am going to take some measurements just to see where you're at. And you let me know if you have any pain or anything. Okay?
Mhm.
Is that okay?
Yeah, that was fine.
Now let's go ahead and look up. All right. Any pain with that?
Yeah, that one was kind of like a stiff type of pain. It's just when I went, it was just really hard to get there.
Okay, and it was in that same spot that you've been complaining about.
Yeah.
Okay. All right, and now I want you to bring your right ear towards your right shoulder. Keep it there. Okay. Go ahead and look up. Any pain with that?
I do have some pain whenever I bend to the right.
Okay, and where is that pain that you're having?
Just in that same area that we were talking about earlier.
Okay, and now let's go ahead and bring this, your left ear towards your left shoulder. Okay, go ahead and come back up. Anything bother you with that motion?
No, that one was fine.
Okay, so now I am going to get on the table because this one I have to be above you, so
Okay.
just so you know. And this next motion that I want you to do is look over your right shoulder.
Okay.
So you can go ahead and do that. Alright, you can look forward. Anything bother you with that motion?
Yeah, I feel like whenever I got like to the end,
Mm-hmm.
there was some pain with that.
Okay, and where was that pain that you were having?
Same thing in the back of my neck on the right side.
Okay. And then let's look over to your left shoulder, same way. Alright, and you can go ahead and look forward. Did that motion bother you at all?
No, that one was fine.
Okay, perfect. So let me go ahead and write these down. Okay, so the next thing that I want you to do is go ahead and lay on your back. And now I'm going to put your neck through some motions, and I just want you to relax. You let me know if at any point you have any pain or anything, okay?
Okay.
How did that motion feel?
It was okay. I felt like there was kind of like a pull in the back of my neck.
Okay,
But I didn't have any pain with that.
okay. And now just relax and turn your head. Relax. How did that motion feel?
That one was fine. No
Okay.
pain.
Turn the other way. Did that feel okay?
That one, whenever I did it when we were sitting, just like in this area right here, I felt like that increased that pain a little bit.
Okay. We're going to do one more motion, okay?
Okay.
How did that feel?
I feel like that one increased that like stiff pain that I was talking about earlier, and it's kind of like on the right side, right
Okay.
here.
Alright. So next what we're going to do is just look at the strength of your muscles around your neck, okay? So the first thing, you can still stay in this position, and I want you to put your hands up like this, resting on the table. And now I want you to tuck your chin down towards your chest, like you're making a double chin. And then I want you to keep that position, and I want you to lift your head up. Okay, so keep it there, and don't let me press you out of this position, okay? Good. Okay, relax. So still stay in this position, and I want you to turn towards the right. And now I want you to lift your head up. Stay in that position, don't let me press you down. Good, relax. Go ahead and turn the other way. Lift your head up. Stay in that position, don't let me press you down. Good. Okay, you can relax. You can place your hands by your side or where they're comfortable. What I want you to do now is keep that chin tucked, and then I want you, and you can go ahead and relax. I'm just going to explain what we're going to do. So what I'm going to have you do is keep that chin tucked like we did earlier, and keep that position and lift your head up, and I'm just going to time you and see how long you can hold that position. If at any point you feel like you need to stop for any reason, you can go ahead and stop, okay?
Okay.
Alright, so we'll go ahead and do that. So tuck that chin and lift your head up. Okay. And why did you feel like you had to let your head down?
Just tired. I just got tired, really.
Okay.
Yeah, I just felt like I couldn't really hold it about that
You
long.
did a great job.
Thank you.
Okay, so now we're going to turn onto our stomach.
Okay.
And we're still going to look at your musculature a little bit more. So still have your hands up in that position, but now they're going to be above your head. And you're perfectly turned like that. And what I want you to do is lift your neck up. Keep in that position. Don't let me press down. Good. You can relax. Go ahead and turn the other way. Same thing. Lift your head up. Don't let me press you down. Good. Relax. Okay, so you can stay in this position, and if you want, you can have your hands by your side or whatever's more comfortable for you. I am going to be placing my hand on the back of your neck and on your upper shoulders just to see if I can feel anything that's going on back there. Is that going to be okay?
Yeah, that's fine.
Okay, and throughout any of this time, if anything is uncomfortable or painful or you'd like me to stop, just let me know, okay?
I feel like with that one, it kind of reproduced that pain that I was talking about earlier with the back of my neck and stuff.
Okay. I'm going to move a little bit further up.
And that one, I feel like when you push a little harder, that one kind of made my headache pain come on.
Okay, well, I'll make sure not to press there. Let me just feel a little bit more around your neck, okay? Okay. All right, so whenever you're ready, we can go ahead and sit up. You can just sit at the edge just like that. I'm going to do a few more things. So you can just sit here. I am going to place my hands on your head and place it in the position that I need it to, okay?
Okay.
So I want you to keep your head there, and I am going to apply a little bit of pressure. You let me know if anything is changed, okay?
Okay.
All right, and now we're going to do the same thing but the other side. Okay. How'd those feel?
That was fine. There's nothing wrong with that.
Okay. Let me go ahead and write a few things down. Okay. So after doing these few assessments, how do you feel right now?
Right now I'd probably say it's about I feel like a 4 out of 10 or so.
And when you say that, is that for, which pain is that for?
Oh, it's probably talking about this pain that I'm talking about in the back of my neck.
Okay.
I feel like a little looser and things like that. I do feel like kind of sore.
Okay. And what about your other pain, your headache pain that you were telling me about?
The headache, it's about like a 2 out of 10.
Okay. So after performing my assessment, there is something that I would like to perform on you and just see how you respond to that, okay? So this is going to require you to lay on your stomach again. So if you want to go ahead and do that. So I'm going to go ahead and start applying some pressure. This should feel like a little bit of a push for a few, I'm going to do this for 30 seconds.
Okay.
This shouldn't recreate any of your pain, but if it does, let me know, okay?
Okay.
Alright, so we're going to take a little break and I'm going to do that one more time.
Okay.
So just relax there. Okay, I'm going to start it again. I'm actually going to do one more round, okay?
Yeah, that's fine.
Sorry about that.
No, you're good.
Okay, so I'm going to go ahead and start it again. Same thing that I've been doing. All right, so we're finished with that. So you can go ahead and sit up. And now I want to check that motion that you said that you were having problems with, especially the one that you said that you really want to gain, and that's the one that you said when you're looking up at the stars.
Yeah.
So let's go ahead and look up towards the ceiling. And we can come back down. And then I'm going to measure that.
Okay.
So same thing. Go ahead and look up. All right. So how do you feel after I did those treatments to you?
Definitely feel like the pain went down. I feel like just being able, whenever you're measuring, just that felt a lot easier than before. I guess just because of that pain went down and things like that.
Well, that's good. So after doing everything today, I do think that you're a great candidate for physical therapy. I think there are lots of things that we can come up with to help decrease that pain, get your range of motion back so that you can go back to work, you can teach those spin classes, and hopefully decrease those headaches and decrease the pain, and just get back to you living life and not having to worry about a lot of these pains that you are experiencing. So what I think is going on with you is that you have some tight muscles in your neck, and then you also have some that need to be strengthened.
Right.
And whenever we do both of those things, I think that will decrease a lot of the pain that you're having and help with the headaches, because when those structures are tight, they can press on that area, and that may be some of the reason why you're having some of those headaches. So I think that we'll be able to come up with a good plan that can help you decrease that pain, get rid of those headaches, and help you get back to living your life the way that you want to. So before I send you away, I do want to give you an exercise for you to do at home to help with this pain that you are having.
Okay.
So this is going to be more of a stretch because I do feel like you are tight a little bit back here just after my assessment.
Right.
So for this one, I am going to want you to lay on the table, and I'm going to have you demonstrate this because you said that's how you learn best.
Right.
Okay, so this one, what I want you to do is to tuck your chin down, but keep your head against the table like you are. And I want you to hold this position for 30 seconds, 3 times. And you can do this twice a day. Okay, so maybe like morning and night, whenever you can fit it in, because I know you have a busy schedule.
Right.
So I do want to see you do that for 30 seconds right now.
Okay.
So whenever you're ready, go ahead and do that. And I'll count for you, okay? All right, you can go ahead and relax. So when you were doing this, tell me what you were feeling.
Felt like a stretch in that area, especially in that region that I was pointing to earlier where I said I had pain. I felt like it was stretching that area.
Okay, so that's perfect. That's where we want to feel the stretch. I do want to emphasize when we do these stretches that we don't want to recreate any pain or anything like that. It should be a nice, gentle stretch. You should feel it in the back of the neck where you are feeling it currently, but we don't want to push it too hard or try and think that further is better.
Okay.
So once we feel that stretch, that's a good place to stop, and you can hold it there.
Okay.
So 3 times, 30 seconds, twice a day. Okay? So you can go ahead and sit up. I would like to see you about 2 times a week for the next 6 weeks, and then we can reassess from there and see how you're feeling then, okay?
Okay.
Do you have any questions for me or any concerns?
I just guess like with my pain and everything. Once we're done with everything like that, that I'll be able to do everything that I wanted to, like perfectly fine, like how I was before this pain started coming up.
I do feel like the way that you responded today and after everything that I assessed, that we will be able to get you back to where you need to be. I don't want to make any 100% promises and say everything, but I feel if you stay consistent with the exercises that we give you and you come here and you consistently try and work on strengthening things and stretching things, I do think that we will be able to get you back to where you need to be.
Okay, all right. Thank you.
Okay, thank you for coming in today.
All right, thank you.